Setting: hospital outpatient clinic. You see a 75-year-old patient who will be starting a course of chemotherapy next week following a surgery on his bowel. He is attending an appointment for information about chemotherapy. Now let's look into the task. First one says, confirm the reason for the patient's appointment. That is information about chemotherapy. Second one says, find out patient's feeling about starting chemotherapy. Third one says, explore patient's knowledge about chemotherapy, such as aim, frequency, and duration. Fourth one says, outline course of treatment. 3-week cycle, 24-week treatment period administered at clinic. Find out if the patient has read the information leaflet, what to bring, procedure, pre-treatment medications, etc. Fifth one says, explain the treatment procedure, blood test, intravenous delivery of chemotherapy drugs, monitoring, food or drink provided, duration 3 to 8 hours. Sixth one says, make recommendations to pass time, books, electronic devices. Seventh one says, describe common side effects such as nausea, fatigue, loss of appetite, taste, etc. Eighth one says, emphasize patient's reaction to chemotherapy dependent on medication, duration of treatment, and level of fitness. Ninth one says, reassure patient about helps available, medication for symptoms relief, and devise helpline numbers. Last one says, remind patient of need to make transport arrangements for after the sessions, not driving, accompanied by family or friends. Now let's start the role play. You can start like, hi, good morning, Mr. Albert. I'm John, one of the registered nurses working in this hospital outpatient clinic. Please be seated. Then interlocutor may tell you like, good morning, nurse. Thank you. Then ask him, may I know the reason behind your visit today? Then interlocutor may respond by saying, nurse, I'm here for an appointment for the information about chemotherapy. In fact, I'm really worried about the procedure as I've never done it before, so I'm really nervous. Then respond to him, okay, Mr. Albert, I totally understand what you're going through. Try not to be worried. We are here to support you. Then interlocutor may agree with that. Then continue by saying, okay, Mr. Albert, before moving further, may I know if you have any idea about chemotherapy? Then interlocutor may tell you like, nurse, the doctor told me that chemotherapy is done to reduce the risk of cancer, returning after my bowel operation. I do not know anything more than that. Then respond to him saying, okay, Mr. Albert, don't worry. Let me explain you the procedure in detail. As you know that chemotherapy uses drugs to kill rapidly dividing cancer cells so that they cannot grow and make more cells. Now, let me explain to you the treatment duration and frequency of chemotherapy. That is, a course of chemotherapy usually takes between 4 to 24 weeks, although it can be more or less than that. During the course of treatment, you usually have around 4 to 8 cycles of treatments. A cycle is a time between one round of treatment until the start of the next. I hope you are following me. Then interlocutor may agree with that. Then continue by saying, apart from that, chemotherapy drugs can be administered at day clinic. By the way, may I know if you have read the patient information leaflet which has been given already? Then interlocutor may respond by saying, yes, nurse, I have read the information on chemotherapy. However, I'm a little confused on what exactly will happen during the procedure. Moreover, how long should I be hospitalized? Then respond to him saying, I can sense your feelings, Mr. Albert. Don't be panicked. Let me explain you that in detail. The treatment procedure starts with a blood test before each round of chemo. This is done to get the level of blood cells that can be affected by chemotherapy. Then chemotherapy will be performed. That is, the drug is infused into the vein. That is intravenous delivery of chemotherapy drugs, which will be carried out for you. After the chemotherapy, your doctor and treatment team will constantly monitor the effectiveness of your treatments. Moreover, you will be provided food and drink after the chemo if you are not nauseous. Then you will be provided 6 short meals instead of 3 large meals, but in short intervals. The duration of the procedure may vary from 3 to 8 hours depending on the situation. Okay, Mr. Albert, I hope you are with me. Then interlocutor may respond by saying, yes, nurse, I understand that. I think I need to be in the hospital for a little longer, so it's a good idea to bring something to pass the time. Am I right? Then respond to him saying, that's really a great idea, Mr. Albert. As you have to be here in hospital for a little longer time, it is better to bring something to pass the time so that you will be more relaxed. That is, you can bring some reading books, and also you can use electronic devices such as music players or video players to make you more comfortable. How does it sound, Mr. Albert? Then interlocutor may respond saying, that would be really great, nurse. Now, I would like to know if there will be any side effects after the chemotherapy. Then respond to him saying, yes, Mr. Albert. Your worries are completely understandable. Let me explain you that in detail. Normally, you may experience nausea and fatigue. Moreover, there are chances of losing your appetite and taste, but don't be worried too much because those problems may not last for long. Okay, Mr. Albert, I hope you're clear now. Then interlocutor may ask you like, yes, miss, I know the side effects, but I just want to understand that will there be any chances of serious side effects? Then respond to him saying, your thoughts are sensible, Mr. Albert. There are chances of reaction to chemotherapy. However, it will be different for each individual. This includes damages to lung tissues, heart problems, infertility, kidney problems, and risk of second cancer. The possible causes behind the reaction depends on several factors such as medication, duration of treatment, and level of your fitness. But don't panic. We have effective medications available to get relief from various symptoms. Apart from that, helpline numbers are also available to clarify your concerns or to get proper advice. Okay, Mr. Albert, I hope you are following me. Then interlocutor may agree with that. Then respond to him saying, okay, Mr. Albert, in addition to that, I would also like to remind you that you need to make transport arrangements after the chemotherapy sessions because you are not allowed to drive after the procedure. Therefore, there should be somebody to accompany you after the procedure. Okay, Mr. Albert, do you have anyone to accompany you back home? Then interlocutor may tell you like, yes, nurse, my family will be there to support me. Then respond to him, I'm glad to know that, Mr. Albert. Do you have any more questions for me? Then interlocutor may tell you like, no, nurse, thank you very much. It was really informative. Now I feel more informed and I'm prepared for the first session of chemotherapy. Thanks for your help. Then respond to him, good to hear that, Mr. Albert. So far, we have been discussing your chemotherapy sessions in detail. I hope I was able to explain everything clearly. If you have any more questions or concern, you can contact me at any time. I'll be happy to help you. Thank you, Mr. Albert, for listening to me patiently. I wish you a speedy recovery. Thank you, guys. A role play ends here.